She invited me to the unveiling of the soccer stadium, and that was pretty cool. That's how D Jones got there, and I got to speak to Carol Van Andel and Dick DeVos. And Dick DeVos actually let me get a pic with him. That was the actual first billionaire. I've crossed paths with a couple of billionaires, but I haven't asked him for a pic. But I wanted to get a pic with Dick DeVos, and he actually let me get a pic. So, as I said, I have a goal of being a billionaire too, and doing cool things for the community, being a global business leader, giving back, and creating equitable, equal access to opportunities for everyone. And so I'm just thankful to be able to speak to the billionaires and just lead and pioneer, because I'm not going to give up on my goals, my vision of being sure that King County is a better place for everyone to live, and not just white people, but everyone, people of color, African Americans, Indians, Hispanics, everyone. I like everybody to have the best of the best opportunities here, and just being able to just be the best person that they can be. And I'm going to continuously grind and do that. Also, I'd like to thank the school district. I was able to speak to the school district. As you guys know, I did earn a $10,000 partnership to reduce violence here in our community with our city government. And it's pretty cool. I spoke to the school district, and they are going to continuously invest into the esports activation. So me earning $10,000, they're going to pour another 10,000 or better into the esports activation. So I'll have a little bit of longevity and a longer vision. And from that, the school district is going to be developing an esports academy. I didn't think they were going to do that, but they're also going to open up their music studio. They're going to open up the basketball court. They're going to open up one of the 6 esports labs in the film and video studio. So we'll be doing a lot of super powerful, innovative things. It's going to be very innovative. It's going to be cool. I'm very excited because we just co-produced a production in Detroit called Gamers. Fago was actually a sponsor of that production, and we actually sold our first viewing out, which is pretty cool. And then we actually are doing another one, and that one is looked to be sold out in Detroit. And we have one of the biggest radio stations in the city of Detroit actually doing this and hosting this. So I'm very excited what the future looks like, because I've already been able to have success here in 2024 and doing a lot of powerful things. And then the city looks to also partner with me to do these esports activations throughout the summer to be sure that the kids have a safe place to do, but a lot of fun and innovative things. Plus, I'm going to be giving thousands of dollars back to the community. If I had billions, I'd be creating 3D houses and other things, but I'll get there eventually. But right now, I'm just going to give the back funding with what I have and what I've earned pitching and reducing violence in our community. So I look forward to this being a positive innovator. And thanks to those billionaires. Thank you. I'll be a billionaire too.
All right. Thanks, Steve. Any other public comment? All right. Seeing none, our next item on the agenda is the consent agenda. Could I get a motion for the consent agenda? Moved by Commissioner Coleman, support by Commissioner McLeod. Any questions or comments? All right. Seeing none, all those in favor, please say yes.
Yes.
All those opposed, please say no. Motion passes. Item number 3 on the agenda comes from the Equalization Department, and it's the amended 2024 apportionment report.
Recommend to the Board of Commissioners to approve the amended 2024 apportionment report. Summary. The General Property Tax Law, PA 206 of 1983 is amended, outlines the responsibility of the Board of Commissioners with respect to the annual apportionment report. At its meeting on October 24, 2024, the Board of Commissioners approved the 2024 apportionment report. On November 5, 2024, Cascade Charter Township voters approved an additional library in Wisner Center millage of 0.1500 for the purposes of funding the maintenance of the Cascade Library and the Wisner Center, which requires the apportionment report to be amended. Attached is the 2024 apportionment report as amended and prepared by the Bureau of Equalization.
All right. Thanks, Sal. Are there any questions or comments on this item? All right. Pretty straightforward. All those in favor, please say yes.
Yes.
All those opposed, please say no. Motion passes. Item number 4 is from the Sheriff's Office, and it's an amendment to the Burn Justice Assistance Grant through the state of Michigan to reduce community violence.
Action requested. Recommend to the Board of Commissioners to accept an increase in the Edward Byrne Memorial Justice Assistance Grant, called JAG Grants, from the Department of Justice, Bureau of Justice Assistance, and administered by the Michigan State Police to support the Urban League of West Michigan's work to reduce community violence, to appropriate an additional $194,000 to the FY 2025 Sheriff's Special Project Fund budget, and to authorize the board chair or designee to execute the grant agreement approve extensions, amendments, and increases to the grant appropriation not to exceed 15% of the total award. Summary. In early 2024, the Sheriff's Office received a grant through the state of Michigan on behalf of the Urban League of West Michigan to address the increase in juvenile crimes throughout the county, many of which involve elements of violence. $125,000 was accepted and appropriated on Resolution 02222426. The award has since been amended to $319,000, representing an increase of $194,000 to the current appropriation. The goal of the grant is to reduce and reverse increasing rates of community-based violence among youth and stop community residents' exposure from this violence. This will be accomplished by providing conflict interruption and mediation to deter violent behavior focused on changing attitudes towards violence. In particular, the objectives are to work intensively with senior high school students who are at risk of involvement with gun-related violence and homicides, to engage students in training to strengthen their interpersonal communication skills in order to acquire and employ alternative strategies for avoiding or de-escalating potentially violent situations, and design an evaluation model to assess the effectiveness and impact of the project. The grant period runs from 1/1/24 through 9/30/25. Prior to signature, Assistant Corporate Counsel will review and approve all documents as to form.
All right, thanks, Al. Is there a motion on this item? Moved by Commissioner Sparks, support by Commissioner Kallman. Questions or comments? Yes, Commissioner McLeod.
Thank you, Chair. There was not a budget included in this, so I wasn't able to see exactly what this was going to be, what was going to be involved in this in terms of additional costs. Can we get some information in terms of what would be included in this additional amount?
Well, thank you. So we are a pass-through. We're the law enforcement sponsor, so there shouldn't be any additional cost to the county that's incurred. It'd all be through the Urban League if any additional costs are needed for staffing or budgetary purposes.
So what exactly is this additional amount going to cover, though? That's what I'm trying to.
Additional services to further their reach. We work in collaboration with them, providing them some statistical analytic data so they can figure out where they can best appropriate those funds to have the largest reach here in West Michigan.
Okay.
All right, any other questions for Under Sheriff Muir? Commissioner Antor.
Thank you, Chair. Morning, Brad.
Morning.
I was just curious, does any of this money trickle down? I've heard from different people within certain townships that there's a truancy issue here in Kent County that is, for lack of a better word, kind of getting kicked down the road a little bit. And there doesn't seem to be as much emphasis on that as there used to be. And I was just wondering if any of this money could be used to maybe beef up that.
If this grant isn't intended for the truancy-related issues, I mean, obviously, if we have safe homes, communities, and schools, we would hope students would attend school. So there may be some indirect connection to that, but it isn't intended for that purpose.
Okay, thank you.
Any further questions or comments? All right, seeing none, all those in favor, please say yes. All those opposed, please say no. Motion passes. Thanks for the information. Now we have to do a little bit of housekeeping and go back to item 3. I forgot to ask for a motion and a second. So item number 3 was from the Equalization Department, and it's the amended 2024 apportionment report. Is there a motion? Moved by Commissioner McLeod. Is there support? Support by Commissioner Sparks. And then just for clarification, we'll re-vote on that. So all those in favor, please say yes.
Yes.
All those opposed, please say no. Motion passes. All right, now on to item number 5, the 17th Circuit Court fiscal year 2025 adult mental health court grant budget amendment.
Action requested. Recommend to the Board of Commissioners to accept and appropriate an additional $30,405 from the Michigan State Court Administrative Office, or SCALE, to the FY 2025 Adult Mental Health Court Grant Budget in the Special Projects Fund, and to authorize the Board Chair or Circuit Court Administrator to execute the grant agreement, approve extensions and amendments. The Board Chair or designee may also increase the grant appropriation not to exceed 15% of the award. Summary. SCALE provides funding for a mental health court, which is a specialized court docket for certain defendants with mental illness that substitutes a problem-solving model for traditional criminal court proceedings. The board appropriated $170,000 of SCALE funds to the FY 2025 Adult Mental Health Court Grant Budget via Resolution 822-2494. SCALE has since awarded Kent County an additional $30,405 for FY 2025, primarily for drug testing due to both rising costs and an increased number of participants being tested, an increase in grant coordinator hours, an increase in contractual services costs, an increase in the cost and hours dedicated to community monitoring, and an increase for additional training and travel, bringing the total award to $200,405. The grant term is October 1, 2024 to September 30, 2025.
All right, thanks, Sal. Is there a motion for this item? Moved by Commissioner Oliver King. Is there support? Support by Commissioner Green. Questions or comments? Yes, Commissioner McLeod.
Thank you, Chair. So I am going to ask the same question for this. So this is a budget amendment, but there's no budget attached. And so I saw in the summary, which was great, that all the things that is this funding could potentially would be used for. And then also in the memo from the court, I believe there was some similar language, but I just wondered specifically, like, what is this additional funding? How is it going to be distributed across the program to support the things that it lists here?
Good morning.
Good morning. How's everyone this morning? Each year, we have expanded the budget and made our programming more robust. And so it's pretty equally distributed over a number of budget areas. It isn't for necessarily a brand new element of programming. We are utilizing electronic monitoring and transitional housing, as well as high frequency of drug testing as deterrent, but also the opportunity for them to demonstrate their abstinence from substances. The budget is available. If you would like that to take a peek at, you're more than welcome. I can get that to you.
Thank you. Chair, I would just also like to request that when we do get budget amendments, that we do have a budget attached to it so that we can just have some clarity on what we're voting for, and then I wouldn't have to ask so many questions. So thank you.
All right. Any other questions or comments? All right, thank you. Seeing none, all those in favor, please say yes.
Yes.
All those opposed, please say no. Motion passes. Item number 6 comes to us from the Health Department. It's the Michigan Health Endowment Fund Community Impact Grant.
Action requested. Recommend to the Board of Commissioners to approve the Michigan Health Endowment Fund Agreement, accept and appropriate $75,000 to the 2025 Health Fund budget for the Community Impact Grant, and authorize the Board Chair or Health Officer to execute the grant agreement, approve extensions and amendments. The Board Chair or designee is also authorized to increase the grant appropriation not to exceed 15% of the original award. Summary. The Health Department has received a 2-year, $150,000 grant from the MHEF as a continuation of the capacity building grant we received to establish the Health Equity Council. This request is to appropriate $75,000 for the first year of the grant to the 2025 Health Fund budget. The remaining $75,000 will be included in the Health Fund's 2026 budget. With the funding provided, the Health Department proposes to award mini grants to community-based organizations who serve diverse racial and ethnic populations and geographic areas within Kent County to address the priorities identified in the Community Health Needs Assessment. These priorities are access to safe housing, access to healthy food options, improving access to medical care, and reducing barriers to navigating the health insurance system. The Health Department was fortunate to receive funding in previous fiscal years to support 3 rounds of mini grants. Through these prior year mini grants, 42 community-based organizations received approximately $416,000. This new funding will allow for a 4th round of awards during 2025 and a 5th round during 2026. The mini grant approach has worked well because community-based organizations are best positioned to determine strategies to meet the needs of the populations they serve. The grant covers the cost of Health Department staff who will facilitate the work, mini grant awards to community-based organizations, and indirect costs. The grant term is October 1, 2024 through September 30, 2026. Assistant Corporate Counsel has reviewed and approved the agreement as to form prior to signature.
Thanks, Sal. Is there a motion for this item? Moved by Commissioner Oliver King. Is there support? Support by Commissioner Sparks. Do we have questions or comments on this? Commissioner Coleman?
Thank you, Chair. I just want to echo Commissioner McLeod from the previous items. I'm just ensuring we have the details, not only for us, but just for transparency to the public for the future. I think that's a good idea. On this one, I'm interested in what the procedure process is going to be as far as awarding these mini grants.
All right, we have Gail Brink from the Health Department here who can answer some of the questions.
Sure. Good morning. What we do is we work through purchasing and there's an RFP that goes out. And then any community-based organization that wants to submit for an opportunity will submit that. There's a review committee that's made up of some health department staff, some members of the community. It's called the Community Voice Group, part of the Health Equity Committee, that reviews them, and then they prioritize them, and then they are awarded. So does that hopefully answers your question?
I think so. Just a follow up. And so, is that like a public process? It sounds like the RFP, anybody can apply.
Yes.
That meets
Yes.
the.
Yeah,
And what's-
it's done through purchasing, so it's just like any of the other RFPs that purchasing does for any
Okay.
other purchase of goods or services. So, yeah.
And what does mini typically mean? As
Mini
the,
is because it's, usually the average award is between $8,000 to $10,000, so that's why we call it a mini grant. It's not a large amount of money. That we have about $50,000 budgeted for the mini grants, so there will be about, 5 to 7 grants awarded.
perfect. Thank you.
Any other questions or comments? Commissioner Antor, did you have a question earlier? Okay, great. Anybody else? All right, thanks for the information. All those in favor, please say yes.
Yes.
All those opposed, please say no. Motion passes. Item number 7 is also from the Health Department, and it's an amendment to the Michigan Department of Health and Human Services Comprehensive Agreement for the Sewer Network Program.
Action requested. Recommend to the Board of Commissioners to approve an amendment to the Health Department's comprehensive agreement through Michigan Department of Health and Human Services, MDHHS. Accept and appropriate $949,103 to the 2025 Health Fund budget and authorize the board chair or health officer to execute the amendment and approve extensions. The board chair or designee may increase the grant appropriation to not exceed 15% of the award. Summary. MDHHS has $949,103 in carryover funds from FY24 and has made them available to Kent County for the FY25 Sewer Network Project. The grant period is January 1, 2025 to September 30, 2025. The Sewer Network Project began in 2021 with collaboration between the Health Department and Grand Valley State University's Department of Cell and Molecular Biology. GVSU collects wastewater samples from 30 sites across Kent County and tests for SARS-CoV-2 in the samples. Results are sent to all partners who have had their wastewater tested. Since the program began in 2021, over 7,300 wastewater samples have been tested. Participants participating in the program include MDHHS, Kennewa Hills Public Schools, Calvin University, Kentwood Public Schools, City of Cedar Springs, City of Grand Rapids, City of Wyoming, Kent County Veterans Home, and the Kent County Juvenile Detention Center. Analyzing the test results allows for the ability to measure the community-wide level of SARS-CoV-2 spread, as well as identifying other specific variants in the wastewater. As of October 1, 2024, respiratory syncytial virus, influenza, and norovirus were added to the testing panel. Funds will be used to support the contractual agreement with GVSU for the wastewater testing. Assistant Corporate Counsel will review and approve the agreement as to form.
Thanks, Al. Is there a motion for this item? Moved by Commissioner Oliver King. Is there support? Support by Commissioner Sparks. Questions or comments on this one? Yes, Commissioner McLeod.
Thank you, Chair. Me again. Just wanted to note that I'll be abstaining from this as GVSU is my employer, and this grant actually runs through the college where I have approval authority, so I'll be abstaining. Thank you.
Thank you. Any other further questions or comments? Yes, Commissioner Antor.
Thank you, Chair. This is nearly $1 million. Is that all being used just for water testing? Is that the only thing it's used for?
Yes, that amount will, for the most part, with the exception of a little bit for indirect cost, that will be passed through to Grand Valley. And that's for the equipment, for their They have reagents and everything used for the testing. So yes, it will all go to, for the most part, to Grand Valley.
It's not cheap.
No, it's not.
Okay, thank you.
Commissioner Coleman.
Thank you, Chair. Having read over this, I just find myself imagining the new molecular biology student who, arrives at Grand Valley and then discovers that this is their job. But I'm just curious, what happens at this point with the information gained from this testing? Like, what benefit does it give to know that there's COVID in the sewage?
Sarah Simmons is here too, and she's the expert when it comes to the testing. So I'll let her respond to that.
I think your question is a fair one. It was the first one we had too. So what we were able to do is we're to be able to take this data that's collected through the wastewater sampling and compare it against population health data to figure out, are we seeing a early flag of disease in our community where we can go out and actually do prevention? And like, let's say with the veterans home, for instance, if we see wastewater sampling that is indicating high levels of either RSV or COVID or things like that, we can alert the staff early so that they can begin testing to reduce the disease spread in that unit, in that facility. So it's really looking at the trends on it's really looking at it as like a sentinel surveillance system, much like we do with mosquito surveillance, to see what is happening or beginning to uptick in our community so we can build widespread awareness.
Commissioner Green.
Thank you, Chair. Just a quick question. In terms of where this will be conducted through GV in the college, in the university, this doesn't sound like a job for the Annis Water Institute. Is it elsewhere?
So this is really truly in the molecular department.
Okay.
The portion of it is processed in the samples are collected. They are brought to the GVSU lab up on Michigan. They're processed, then they are transferred to the Kent County Health Department to go through the tail end of the processing. So it's a combined shared work that we do together, them using our space with their students and whatnot. But there is no connection with the Annis Institute.
Thank you.
All right, any other questions or comments? All right, seeing none, all those in favor, please say yes.
Yes.
All those opposed, please say no.
No.
All those abstaining? Motion passes. Our next item on the agenda also comes from the Health Department. And it's add one full-time clerk to position for hearing and vision program and amend the Michigan Department of Health and Human Services comprehensive agreement.
Action requested. Recommend to the Board of Commissioners to add one full-time clerk to position, approve an amendment to the Health Department's comprehensive agreement through the Michigan Department of Health and Human Services, accept and appropriate $236,702 to the 2025 Health Fund budget, and authorize the Board Chair or Health Officer to execute the agreement and approve extensions and increases to the grant appropriation not to exceed 15% of the original award. Summary. MDHHS received an overall increase in funding of $5 million for the FY 2025 budget year. As a result, MDHHS assembled a work group to recommend a fair and equitable funding formula for local health departments. The recommended formula includes a base funding in the amount of $60,000 and an additional allocation based on student count and the percent of students that are economically disadvantaged within the county. The Health Department's share of the overall increased funding is $236,702. The Health Department has 10 hearing and vision technicians that are responsible for screening children from preschool through high school in Kent County. Approximately 86,000 children are screened each year in 374 schools, Head Start, daycare centers, and special clinics held at the Health Department. The proposed full-time Clerk 2 position will be responsible for managing the program's phone line, scheduling and facilitating the special clinics, overseeing the maintenance of all screening equipment, following up on failed screens, assisting families in finding care, and assisting with Medicaid billing for over 13,000 screens annually. The annual salary and fringe costs for the full-time Clerk 2 position is $87,800. Funding will also support 0.1 FTE of an existing public health program supervisor with salary and fringe costs of $15,508 and keeping an additional hearing and vision technician position on staff over the summer months with a cost of $20,550. An additional $48,812 will be used to support technology, equipment, supplies, and indirect costs. The remaining $64,032 will offset existing expenditures. The grant period is October 1, 2024 to September 30, 2025. If funding is eliminated or decreased, the position will be eliminated unless continuation funding is approved pursuant to the fiscal policy on grants, contracts, and donations.
All right, is there a motion for this item? Moved by Commissioner Oliver King. Is there support? I'm sorry, support by Commissioner Hildenbrand. All right, questions or comments on this? Seeing none, all those in favor, please say yes.
Yes.
All those opposed, please say no. Motion passes. Item number 9 is also from the Health Department, and we're adding 1 full-time outreach worker position for the Wise Woman Program.
Action requested. Recommend to the Board of Commissioners to add 1 full-time worker position. Approve an amendment to the Health Department's comprehensive agreement through the Michigan Department of Health and Human Services to accept and appropriate $90,436 to the 2025 Health Fund budget and authorize the board chair or health officer to execute the amendment and approve extensions. The board chair or designee may increase the grant appropriation not to exceed 15% of the original award. Summary. The Health Department has been awarded $90,436 from MDHHS to implement the Wise Woman Program in Kent County. This program provides funding for an outreach worker position to connect Wise women clients to healthcare providers in the county for a health risk assessment, to offer personalized support to ensure clients attend their clinical assessment appointment, and to make referrals for social support services. Cardiovascular disease is the #1 cause of death in women in Michigan over the age of 25. It continues to be a major contributor to morbidity and significantly impacts quality of life. Wise Woman is a Centers for Disease Control and Prevention model program which connects women with a healthcare provider for early detection and prevention of cardiovascular illness. The outreach worker position will be responsible to enroll 300 women per year into the Wise Woman program and complete the required follow-up and documentation. Funding supports the addition of 1 full-time outreach worker position with a 9-month cost for salary and benefits of $55,978. It also supports 0.1 FTE existing public health program supervisor position with salary and benefit costs of $11,507. The remaining $22,951 will fund supplies, training, computer, software, and indirect costs. If funding is eliminated or decreased, the position will be eliminated unless continuation funding is approved pursuant to the fiscal policy on grants, contracts, and donations. The grant period is January 1, 2025 through September 30, 2025.
All right, thanks, Sal. Is there a motion for this item? Commissioner McLeod, is there support? Commissioner Oliver King. Questions or comments? Commissioner McLeod.
Thank you, Chair. So this sounds like a great program. I just wanted to know, is it totally new, or has this sort of outreach for women in relation to cardiovascular disease been being done, or is this just going to enhance that? And then secondly, I see that this funding is going to be part of the comprehensive agreement. And so after this 1-year period, would the expectation be that this position is rolled into the funding for that full agreement?
Yeah, as far as the program, it is a brand new program for us. It's kind of piggybacked off our breast and cervical cancer control program because of the success we've had with that and the number of women we've enrolled. The state approached us to say it would be a perfect fit for for us to take advantage of the women that we're seeing in the breast and cervical cancer control program and offer them this service as well. So it is a brand new program. And then as far as that is, it is part of our comprehensive. There's never a guarantee that it will continue, but they have basically said, yes, this will continue. They're getting federal funds through their grants that are passed through to us, and there's no indication that would be eliminated at this point.
That's awesome. So, congrats for being considered as the pilot for this program. It sounds like it will be, a great way to ensure that, women are not, dying sooner than they should. So thank you.
Thank you. Any other questions or comments? All right, seeing none, all those in favor, please say yes.
Yes.
All those opposed, please say no. Motion passes. Now we're on item number 10 from Fiscal Services, and it's the Gerald R. Ford International Airport Authority Revenue Refunding Bond Series 2025.
Action requested, recommend to the Board of Commissioners to authorize the issuance of Gerald R. Ford International Airport Authority Revenue Refunding Bond Series 2025. Summary. Authorized under Act 95, Public Acts of Michigan, 2015, the county is permitted to form the authority and to issue revenue bonds in accordance with Act 94, Public Acts of Michigan, 1933, as amended. The proposed resolution will authorize a bond refunded by the authority in an amount not to exceed $78 million of Series 2015 refunding bonds and Series 2015 revenue bonds in the pledge of the county's limited tax full faith and credit on the bonds. The County Fiscal Services Director is authorized to execute a certificate of the county to comply with the continuing disclosure and all other documents as necessary in order to close on the issuance of the proposed bond. The County Administrator and Chairperson of the Board of Commissioners are each authorized to prepare and approve portions of the official statement that will pertain to the county. The bond proceeds will be used to refund 2 series of the 2015 series bonds maturing between 2036 and 2037 at an estimated savings of $6.45 million. Staff anticipates closing on the bonds prior to June 30, 2025. Bond counsel has reviewed all documents.
All right, thanks, Al. Is there a motion for this item? Moved by Commissioner Hildenbrand. Is there support? Lots of support. Support by Commissioner Coleman. Questions or comments? We do have members from the airport staff here that could answer them. Any questions or comments? Oh, Commissioner Coleman.
Thank you, Chair. Excuse me. Just a comment. I have often voted against increasing our debt here at the county, and just as often have voted to support things like this, which don't increase the debt but just save us money. So I'm very much in favor of saving money, and so I'll be voting for this. But it did remind me. I went and looked, and this Series 2015 refunding bonds was one of the first instances that I voted against increasing our debt here in Kent County. And as I recalled, that was rolling up lots of old debts as well. So I went and looked, and indeed the oldest one rolled into those 2015 bonds was from 1995. And so I think we should just continue to be vigilant, trying to avoid a perpetual cycle of debt here in Kent County. And while Kent County has been a model comparatively of fiscal responsibility, our national debt is certainly not. And that's an example of when you're not careful with that, it just gets out of control. And so in 2015, when we voted on these initial bonds, the United States had $18 trillion worth of debt, which is a lot accumulated over, more than a couple of centuries. Just in the time since we voted on those 2015 bonds, another $18 trillion in debt has been added to our national debt. So I think that's just an example of why we want to continue to be vigilant when it comes to debt.
All right, any other questions or comments? Seeing none, all those in favor, please say yes.
Yes.
All those opposed, please say no. Motion passes. Now we're on to Commissioner Miscellaneous. Is there any Commissioner Miscellaneous? No? All right, we are adjourned, and our next meeting will be on Tuesday, December 3 at 8:30 a.m. And that'll be the second to last meeting that I get to serve as chair of the finance committee. So we'll see you then.